Hello, my name is Dr Sriram Narayanan. I'm a vascular surgeon with the Harley Street Heart and Vascular Center at Gleneagles Hospital. Vascular surgery is the surgery of arteries and veins, which are the blood vessels that carry blood around the body. So really we are surgeons for the circulation. And today I'm going to speak to you about pelvic congestion syndrome, which many people would think is a gynecological condition, but we now understand is actually a vascular surgical condition. Pelvic congestion syndrome is a combination of symptoms. It's a set of symptoms that includes chronic pelvic pain, that's pain below your belly button, and that is associated with painful periods, as well as very heavy periods. It can also have painful sex or intercourse as part of its symptom group. So if you really look at it, you're looking at heavy painful periods, the pain being just the day before or the first day of the period, and some painful sex, which I suspect is something that a lot of women who hear this will raise their hand and say, that happens to me as well. Pelvic congestion syndrome can affect women of all ages. Understandably, the symptoms will begin after they reach puberty and they start their periods. And the symptoms can get better when they reach menopause, when the periods end. But the periods tend to be much more painful and the symptoms tend to be worse just before they have had children. So some women get better after they've had one or two children. And there are reasons why that happens. It's not that this syndrome gets better, it's just that the syndrome redistributes itself in terms of the symptoms you get. So it can affect women of all ages, and very commonly you will probably hear about in the 18 and 19 and 20 years of age, very painful periods. Sometimes they lose time from work. I know of junior colleagues who reset their on-call rota or emergency on-call rota because they know it's going to be a painful time and they often take time off. But once children are born, it can get a bit better in women, and often after the menopause, at least the symptoms related to bleeding obviously will disappear, and periods are obviously not heavy after they've had a menopause. This term period cramps, which essentially refers to girls as they are just beginning to grow up, achieve puberty, and in the early days after they begin their period. They have this discomfort a day or two before the period and on the first day of the period. And because we've not known what it is, we've referred to it as period cramps. Girls overdose themselves on painkillers and hot water bottles that their mothers provide for them, but we've never really known about it. But if you ask me what's the difference between the two, the truth is none. Period cramps are actually the most classical symptom of pelvic congestion syndrome. Almost all women will have a mild degree of pelvic congestion just before and during the period. That is normal because there's an increase in blood flow and an increase in the amount of veins there. But not everybody gets symptoms. But period cramps are no different from pelvic congestion, and especially if they don't settle down as the cycle regularizes, then they are pelvic congestion syndrome. There's no difference. If you have any queries about pelvic congestion syndrome, or as the new term for it is, pelvic venous hypertension, which is the new term that has been recommended, please contact us or contact your family physician or your gynecologist, and don't ignore these symptoms as something that you just need to live with.